Well, when it comes to vision surgery, the future is now. No blades, no stitching, and a revolutionary new procedure is safer and more precise. It will change the way the medical community tackles a problem that really affects millions of people. One woman recently underwent the procedure called laser corneoplastique. She was legally blind and was originally told nothing could be done for her. She was referred here to Jacksonville to Dr. Gulani, and with his groundbreaking treatment, he has helped restore her vision. So joining me now, we have Dr. Gulani of Gulani Vision Correction, also his patient, Dr. Margarita. Thank you so much for coming in. And you're from L.A.
Yes.
And the interesting part about you're really from Russia, but you live in L.A.
Yes.
But you actually came here to Jacksonville for this surgery. What made you realize that this was the place to be?
So after having a surgery 20 years ago in Moscow, my vision started to decline. And last year I had a very drastically declining right eye. And I went to my doctors, ophthalmologist in LA, in Westwood, and they told me they cannot do anything for this eye. Then I did a lot of research and I found Dr. Gulani, and one of the doctors knew him and he referred me to him. And then I came here, and
the rest is history. Yeah, and you just had your surgery yesterday, which is amazing that you're here today.
The most important thing, nobody else wants to touch me.
Right.
Nobody else wants to help me. Only Dr. Gulani, which one? It's really amazing.
Because you thought there was no hope, but Dr. Gulani, you said there is hope, and there's a way to get this done. And you know, the next day she's out here interviewing on television.
It really is, Melanie. Laser corneoplastique is my endeavor, a technique and concept where you marry the latest technology, but you also custom design technique, bringing them together to take patients today who are having LASIK or cataract surgery to even beyond 20/20 in many cases, and patients who had previous surgeries like LASIK, RK, cataract, they can be fine-tuned back to excellent vision too.
Right.
So if you look at it from the concept of a custom designed suit, not only does it cover you, it enhances your best potential. Why wouldn't patients want surgery that customs designs to them the best capacity you have?
And for someone like you, Margarita, who actually, you were having issues, then you had the surgery, you thought you were in the clear for many, many years, then all of a sudden, boom, you are legally blind. I mean, what's it like now, the day after the surgery? Is it better than it was before?
Much more better, and I hope it's going to become more better because I am in a healing process, and then I can see a big difference. And I'm really thankful to Dr. Gulani.
Yeah. What's the journey here? Because we talk about this tourism medicine where people will travel to get the best doctor and the suitable doctor for them.
I think because people now can research for the best surgeon, best technologies, they are willing to fly. I mean, Dr. Barsegan is from LA. Her surgeons, when they referred her here, they knew that these techniques work because I've been teaching this. We're going to teach again next week in the national meeting in California. So when you spread this concept, Melanie, it's so much like the whole rhythm of patient expectations. I want it to change. I don't want them to go for cookie cutter techniques anymore. They should be, okay, this is me, what's my best capacity, and can I have technology and technique designed for me?
Right. Now, Dr. Allen, let me ask you, because I know that insurance comes into play and whether or not people can afford this. When you are customizing a treatment, is it more expensive than what you would get otherwise?
Not necessarily. Sometimes, again, the same concept of how driven we are to design it to each patient. Some of these procedures are partially covered by insurance, some may be completely, and many a times, yes, they may not because these are technology choices.
Right.
And the patient's also making that choice, but then vision is such an important sense.
It is, yeah.
You must take your time to make that decision. There's no need to rush into something and then regret it. Why would you live with mediocre vision ever?
And you're a doctor, so you know that the options are out there, but maybe some of our viewers don't know. Knowledge is power, I always say, and even if it's not something that you can afford now, at least you know it's out there, and there are options for you. And so what's your next step? When do you leave?
So I'm going to go follow up to my ophthalmologist here, and we're going to call Dr. Gulani and then follow up. And also I want to do for the left eye in the future because my left eye still functioning, but it's not perfect.
You want perfection.
Yeah.
And you're going to get it. All right. Very good to see you, and congratulations. Thank you, Dr. Gulani, for sharing with us. And again, you are local, so if you have any questions, you certainly can check him out.